Dr. Ariel Dalfen is a psychiatrist at Mount Sinai Hospital, where she is the head of the perinatal mental health program. She is also the head of the perinatal mental health telemedicine program at Sinai, an innovative, first-of-its-kind program that provides specialized mental health care to women around the province of Ontario using mobile health technologies. Dr. Dalfen is an assistant professor in the Department of Psychiatry and is published in both the professional and lay literature. She lectures frequently and speaks to public audiences as well as medical audiences. A recent book, When Baby Brings the Blues, Solutions for Postpartum Depression, is highly regarded. It's been translated into a number of foreign languages and is an outstanding resource. I'm delighted to introduce to you Dr. Dalfen.
Thank you so much for the kind introduction, Roland, and thanks to everybody for having me here tonight and organizing this very important event. And thanks to all of you for coming out on this cold night, babies in tow in hand. And don't worry about staying here if babies are crying. I'm used to talking over crying babies and in the office all the time. So I was always told it's never a good idea to follow a rabbi on the podium, and now I'm following two. So I'm going to do my best to talk to you tonight about some of the issues that we see in our perinatal mental health program at Mount Sinai Hospital. First, I'm just going to talk to you a little bit about the numbers, because I think people are always astounded to find out how many women and their families are impacted by perinatal mental health issues. We know that between 10 and 20% of pregnant women and new moms experience depression and anxiety and some type of mental health problem at this very vulnerable stage of life. And just for perspective, probably about a quarter, 25% of Canadians have diabetes. About 15% of Canadians probably have heart disease. So we're talking about a very, very common problem. And I think it's always helpful to look at the numbers and look at the numbers in comparison to other issues to say, hey, you're not alone, and you're not alone in experiencing this. And it's a very, very common experience that not only impacts a woman and her experience during her pregnancy and as a new mother and her ability to cope as a new mother, but of course, and you'll hear other people talk about this more later, it impacts her partner, it impacts her family, and it has a very wide-ranging ripple effect, and then of course a ripple effect down to the next generation of the baby. And I say that with a caveat because women always come into my office and saying, I'm so scared to be here and I'm really worried that I've been suffering with depression and anxiety. Is this going to affect my baby? And I've read all this stuff that this is really going to have a terrible effect on my baby. And so I say that, I put that out there because I think it's important not to add additional guilt and additional blame on women who are pregnant and on new moms, that really we can turn this around, and that's the hopeful message that I want to impart tonight, that untreated, very severe mental illness, yes, that does have an impact on the baby and on future generations. But if you address it, and if you get treatment, and if it's turned around, and if it's caught in time, then there's nothing to worry about. And I think that's the really hopeful message, not to walk away with a feeling of guilt and shame, but to understand that even though there will be an impact with untreated mental illness, that treatment really, really can help. Unfortunately, we know that only about half of women who do experience mental health problems at this life stage actually do come forward for help. And again, just to use the term that we're relying on really heavily tonight, one of stigma. Stigma runs very large in this population. We almost call it a double stigma. Not only is it the stigma of mental illness in general, where people feel like something must be wrong with me, what's the flaw in my character that I'm experiencing this, but they also feel that at a time, as Roland alluded to, that this should be the happiest time of my life. I should be so grateful that I've been able to get pregnant, that I've been able to have a baby, and I feel none of those positive feelings. And that's a horribly scary and shameful feeling for a lot of women. So that keeps them from speaking out sometimes to their partners, to their families, and to healthcare providers, because they're worried people are going to judge them, or they're worried about having their babies taken away. And that doesn't happen. When people are coming forward and they're asking for help, in the very, very vast majority of situations, there's no need for any of that action to be taken. There's also all kinds of external barriers that people face for help. A lot of times people will go to one of their physicians or healthcare providers and they'll say, oh, you're fine, you're okay, this is what it's like to be pregnant, or this is what it's like to be a new mom. And then they just walk away thinking, okay, I guess it is, and I'll just keep on suffering like this. We also know that in certain cultures, in certain cultural groups, there are even stronger barriers, and there are even stronger stigma against speaking about mental illness or speaking out about mental illness at this life stage. Some of the things we encounter within the Jewish community, and some of the things that women, often more observant women, seem to feel, are a very strong sense that I'm supposed to have all my life wanted this, and I'm supposed to be a woman of valor, an eshet chayil, and there's nothing that's making me happy at this stage in life. And I feel very much shame in that. And there's also a sense of thinking you have to be fruitful, you have to multiply, and if this happens once to someone, it can be very shameful for a woman to feel that within some elements of the Jewish community. So that's a bit of an added flavor that we see a fair bit. And of course, in addition, a lot of people have trouble moving around during pregnancy. So it's hard for them to come and to get help and to come downtown to the hospital. And it's hard for them postpartum if they're suffering with any kind of medical complications, or even just trying to get out of the house with a new baby and in the winter. And so plus, those are all the reasons that we see people not coming forward to get care. So what are we talking about when we're talking about these illnesses? So I'm going to just give a very brief overview of the main illnesses that we usually see. First off, there's something that we call baby blues that happens, and this happens postpartum. Happens to about probably 50 to 90% of new moms. It's not considered a psychiatric illness, but it's the feelings in the first couple weeks postpartum of feeling overwhelmed, feeling exhausted, thinking, how did I get myself into this? How am I going to get myself out of this? And really feeling very, very overwhelmed. And I mention it because it's such a common experience. Again, it's not a psychiatric diagnosis, but it's something in women who might have had a history of a psychiatric diagnosis that we pay really close attention to. Normally that goes away with good sleep, helping someone identify their support network, helping them really sort of adjust and accept that this is going to be a steep learning curve and that there's a lot to learn. That usually goes away after a couple weeks. But if it doesn't, if the symptoms of sadness and crying and not being able to take care of oneself, or not wanting to take care of oneself or a baby, or feeling any joy or connectedness, then we're into the category of a depressive episode. And that can have all the symptoms I've described. And then when it gets more serious, sometimes women will have thoughts about wanting to harm themselves or harm their babies. And those are real emergencies, and that's when people really need to come forward and get help very, very quickly. We also see a very high rate of anxiety among women who are pregnant postpartum. And anxiety can have many manifestations, but a lot of it is probably what you're thinking of, is constant worrying, constant feelings of being unable to make a decision. Am I feeding the baby enough? Do I have enough breast milk for the baby? Am I dressing the baby warm enough? And if in pregnancy, did I eat the wrong thing? Did I eat too much? Did I eat not enough? What does this mean? What does that mean? And every pregnant woman and every new mom worries to some degree. It's part of the package of motherhood, I'd say. But when the worries don't turn off, when the worries take up so much time that they interfere with sleep or interfere with one's ability to function, and they can't turn it off and settle it down, then we're into the category of concerning worry and concerning levels of anxiety. There are other forms of anxiety disorders too. We see a lot of what we call panic disorder, which are when women have panic attacks that may come up out of the blue. That may make them scared to go out with the baby or scared to be alone with the baby. And then there's a few other types of anxiety that I'm not going to get into right now, but I'm happy to answer any other questions about. But I just want to highlight those as being some of the very common mental health issues. People often come in to our offices and say, why is this happening to me? And why is this happening to me right now in life? As psychiatrists, when we're trying to understand the answers to those questions, we use what we call, and I think it's a very useful model, it's called the biopsychosocial model. So we look at someone's biology, and that would mean what's happened in their brain, what's happened in their medical history, what's happened in their past physical life, if they had a history of a mental illness. And if those pluses add up in those categories, that can put someone at very high risk of issues. Then we look in the category of psychological issues. There are certain personality types or certain ways that people see the world that maybe make them more at risk of developing postpartum depression or anxiety. One of the most common ones we see are women who are what we call type A, perfectionistic personalities. So often these are people who are high achieving, have accomplished a lot in their life to date, and are used to really feeling a sense of mastery and control in their life by being on time, being in control, and being able to accomplish things. Of course, those of you who've already had children, or those of you who have seen what life with a newborn is like, all of that gets thrown out the window when you come home from the hospital with a newborn who doesn't want to stick to your schedule, doesn't want you to get things done as you want to, doesn't allow you to feel a sense of mastery or control in any sense of the word. And for women with a particular personality type and strong personality traits, type A personality, it can be a very, very challenging time and be a source of a lot of anxiety. That's one of the common psychological risk factors for these illnesses. And then finally, in the social bucket of risk factors, we know that people who have poor support systems, or people who've had challenges in other ways with relationships in the past or in the present, or who are living in less optimal circumstances in poverty or with all other kinds of challenges, that can be another major area of risk factors. Usually it's not enough to just have one of these risk factors that I mentioned. It's often a combination in larger or smaller amounts that puts someone into the risk category of having an illness at this time of life. But the good news is, as I started off by saying, there are treatments available. And again, when we're looking at treatments, we often break them down using our biopsychosocial model. And we try and treat the issues that might come up in each one of those buckets. So biologically, we always encourage people to try and get as much sleep as we can so that their brains can readjust. There are a lot of medications, and again, I'm not going to get into the specifics of medications right now, but basically, if you don't remember anything that I've said tonight, just remember that most psychiatric medications are safe during pregnancy and during breastfeeding. There are very few exceptions, but by and large, many of the medications have a lot of data to support their use. There's a lot of evidence that's been accumulated over the years, and there are good medication options. Sometimes medication is used for the more moderate or severe types of depression. Sometimes people opt to use it with a more mild form, but there are good medication options that are safe at this stage in life. Then psychologically, we often use a lot of different types of therapy, whether it's group therapies or couples therapies or individual therapies of various kinds. A lot of the times, these illnesses will respond to therapy, often on its own, if it's in a much more mild category, and often in combination with medication, if someone's suffering with a more moderate or severe experience. And then socially, we help people look at their own personal support networks. We help them look at who is in their community that they identify with, who is in their city, what are the resources all around. and who are the professional supports and resources that they can turn to and that they can rely on to supplement the treatment. So all that to say that there is the saying that it takes a village to raise a child, and that's 100% true. And it also takes a village to really help a woman and her family who are suffering. And the more members of the village that come together and can add in different components of support, and the more pieces of the puzzle that can come in to bolster someone who is suffering, the better a woman's chances are of feeling better and getting better and going on to enjoy her life as a mother and her life as a woman and as a member of society. So I'm going to close on that note, and I'll be happy to answer any other questions